Hi everyone, welcome to week 6 of your Pharmacology 1 course. We're going to be covering 2 chapters this week with lots of material. The 2 chapters that we're going to be covering are chapter 7 and 8, which cover the urinary drugs and the GI system drugs. So there's a lot of material, and I'm providing you with the PowerPoints for both of the chapters so that you can go in and review them. But as with all of these chapters, what I really want you to focus on is learning some of those indications, some of those causes, disease states that we're going to be using these drugs for, and the different categories of those drugs. When we talk about the urinary system, again, they're going to go through in this chapter and kind of go over the different parts of the urinary system and things like that. What I want you to focus on, like I said, is the different type of drugs that we're going to be using for that system. Some of those drugs include diuretics, potassium supplements, and we'll talk a little bit more about that. They kind of go hand in hand with the diuretics. We're going to talk about drugs used to treat UTIs. We're going to talk about analgesic type of drugs. We're going to talk about drugs that have antispasmodic effects. We're also going to talk about drugs that have that treat overactive bladder, even BPH, benign prostatic hypertrophy, and erectile dysfunction, and prostatitis. So everything that deals with the urinary tract is covered in this particular chapter. So when we think about the different drugs, diuretics are included on here because the kidneys are part of the urinary tract system. Since the kidneys do all the filtering and circulating of the blood, they're also used to eliminate excess fluid. So that's why diuretics are included in this particular category. Diuretics are frequently used to help treat high blood pressure and other types of and conditions like swelling and things like that sometimes go along with high blood pressure, sometimes they don't. But the key with the diuretics is that we've got several types of them. They actually come in several different categories, and they all work in a little bit of a different way. So as you go through this chapter, you'll be looking at some of the different categories of diuretics and how they work. So specifically, we've got 5 categories that are covered in your text. We have the thiazide diuretics, we have the loop diuretics, potassium-sparing diuretics, osmotic, and the carbonic anhydrase inhibitors. And as I said before, all of these work a little bit differently within the kidneys to help us excrete water. The key here, though, is that most of these, all but the middle one, all not only do they help us, remove water, excess water from the bloodstream, but they also remove some key ingredients that we need. So things like sodium and potassium are typically lost in that process as well. And those 2 minerals are very, very, very important for proper cardiac function. So anytime we're taking 4 of the 5, everything but the potassium sparing, we typically want to monitor the potassium levels specifically of the patient to ensure that we don't have any side effects with cardiac issues. So keep that in mind as you're going through. A lot of times docs are going to try to prescribe the potassium sparing so that they can avoid some of the issues that come along with the other classifications of diuretics. So there are some combination diuretics that take both into account, so that you don't have to worry as much about that. But a lot of times, any folks on these diuretics, they're gonna be getting a lot of blood work done to make sure that their levels stay correct. Then in addition, if they are taking some of these drugs, they may be prescribed potassium supplements. So those supplements would be in, because of the fact that they're taking those diuretics. K-tabs is a great example of one. And this one's actually, when you open it up, it's a yellow tablet. And honestly, if you open up the bottle, it actually smells like vanilla, kind of, in my mind. So has a very distinctive smell. It's a very common potassium supplement that's used with these diuretics. And then in addition to those things, you're also going to be looking at drugs that are used to treat UTI. So urinary tract infection, that's what UTI stands for. And again, there's different categories of drugs that are used to treat UTIs. They can be penicillin-based, cephalosporin-based, sulfonamide-based, all of those types of categories. And we have different ones that fall into different categories. So some of the ones you may be more familiar with, ampicillin is definitely one that's kind of a common one that you may have heard of. Let's see, we've got the ciprofloxacin or Cipro. That's another common one that you'll see. Floxin is a common one. Let's see. You may also be seeing, I'm trying to find some of the others that you're going to see frequently to point those out to you. Let's see here. Bactrim, Septro, those are also common ones that you're going to see. And then, of course, you know, as we go through these slides, there's always going to be those little helpful hints, helpful tips. Cranberry juice, we may have all heard of cranberry juice as being a way to prevent UTIs. And it definitely does work. And it kind of gives you a little information about why it works as we go through this chapter. In addition to the antibiotics that you're prescribed with UTIs, a lot of times they'll prescribe some sort of analgesic. And the purpose of that is to help with the burning and painful urination and that urgency. Probably the most common analgesic is pyridium. Sorry, can't say that this morning. So those are some of the things that you'll see with that. Another group of drugs that you'll see with the UTI or with the urinary tract is antispasmodics. These are usually used when we have an infection, maybe problems from catheterization, kidney stones, things like that. And as we also mentioned, not only do we include all of these drugs, but we include the drugs for overactive bladder in here. Probably the most commonly prescribed one is Detrol LA. That's used for overactive bladder. And then we have the drugs that are used to treat the prostate. So we have those that are for BPH. Those are androgen inhibitor drugs. So Proscar is one of the most common ones that you're going to see there. Avodart is another one that you're going to see that's frequently used. So those are some of the highlights of the chapter 7 on the urinary drugs. The other chapter that you're going to be covering this week is chapter 8, which is the gastrointestinal drugs. And this category covers things like, everything for things like anything dealing with the stomach. The gallbladder falls into this, the liver falls into this. So anything we think of the GI tract, that's what's going to fall into this. So that could be ulcers. It might be GERD. It could be diarrhea, constipation, colitis, excuse me, nausea and vomiting, hepatitis, and even obesity. So all of those things fall into the GI system drugs that we're going to be looking at. So there's going to be drugs that we're going to be using to treat peptic ulcers, heartburn. Some of the heartburn medications are obviously things that you're going to be seeing on over the counter. Let's see, some of the antacids that you're going to see. Some of these are pretty common. Most of us have heard of, Alka-Seltzer and things such as that. Also, another combination group of antacids, Mylanta, the Maalox, the Rolaids, those types of things. As we move into some of the things that are for heartburn, we'll look at some of those that are what we call H2 blockers. So H2 is histamine receptors, so that's why they're classified as such. So those are for heartburn, GERD, peptic ulcers, things like that. Some of the common ones that you're going to see: Tagamet, Pepcid, Axid, Zantac. A lot of these over the counter nowadays. And then this is just an example of a picture of what the Pepcid looks like if you've not had a personal relationship with that one yet. Some of the other things that we're going to be looking at are the group called the proton pump inhibitors. So that's just another way that we treat peptic ulcer and things like that. And it just does it in a different way. Nexium, Prevacid, Prilosec, those all fall into that category. We also are going to be looking at those things that are used to treat GERD. Again, proton pump inhibitors are typically used for that. Again, that's the Nexiums, the Prilosecs, things like that. Some of the other things that you're going to be looking at are those antispasmodics, which can be used for things like vomiting and diarrhea and things like that. Okay, so we've got the Donatols and things like along those lines. Antidiarrheals, Imodium is probably the most common one that you're going to run across with those. We also do have some narcotic type drugs for diarrhea, and those are used in severe situations. Paregoric is a form of opium, and it's a scheduled drug. Then, of course, we have things like Pepto, pretty common. And we've got those that are laxatives. Laxatives work in several different ways as well. Just trying to go through some of the most common ones with you real quick before we run out of time. You're going to be looking at antiemetics, which help with keeping you from vomiting. Those are used a lot of times in conjunction with surgeries. A lot of folks get sick to their stomach with the anesthesia, so they give the antiemetics along with them. They also give them along with chemotherapy drugs. Some folks struggle with motion sickness, so those are used for that. Dramamine's a real common one that you're probably familiar with. Another one that's used is Antivert, so that's another one that's used for vertigo. Let's see. Of course, there's drugs that are also used for hemorrhoids, drugs that are used for obesity, and all of those fall into this category of GI drugs. So as you're going through these two chapters, lots and lots of material. If you have any problems or questions as you're reviewing, as always, please feel free to email, call, or text. My number is 618-792-2293. Have a great week.